The patient should be evaluated in the standing position and the posterior axillary line marked on the skin. The percutaneous puncture should never exceed this limit ventrally, in order to avoid injuring the abdominal organs near the kidney, especially the colon. The patient lies supine and two further reference lines are drawn dorsally to the posterior axillary line, the 12th rib and the iliac crest, thus delimiting the space for the percutaneous puncture. Two separate jelly pillows are put under the thorax and the gluteus in order to enlarge the space for puncture posteriorly, while the contralateral leg is well abducted so that instruments for retrograde procedures can be maneuvered freely. In the course of time, urologists usually employing the prone position made many efforts to limit its disadvantages. Preoperative positioning of the anesthetized patient, rotating him from the supine to the prone position, is certainly the first problem. This job should be carried out by at least 5 well-trained persons, otherwise joint trauma might occur, as well as displacement of the endotracheal tube, venous access and urethral catheter. This keeps the anesthetist busy and prolongs the duration of both the operation and anesthesia. Thoracic compression due to the abnormal position of the patient is a relevant issue because the reduced pulmonary expansion may require application of a rigid endotracheal tube with higher insufflation pressures. The space for percutaneous puncture in the prone position is limited medially by the paravertebral muscles, laterally by the posterior axillary line, cranially by the 12th rib, and caudally by the iliac crest. The space for percutaneous puncture in the supine position is limited ventrally by the posterior axillary line, dorsally by the paravertebral muscles, cranially by the 12th rib, and caudally by the iliac crest. In this position, the kidney lies nearer to the skin.